Our top story today is the announced closure of Abbeyleix Community Nursing Unit on a phased basis by the Health Service Executive. In a statement released yesterday evening, the HSE says it cannot continue to offer a safe service in view of the reducing financial allocation across all services, continued reduction in staff numbers and difficulty in meeting HICWA standards. Now, if you were listening earlier, you will have heard from various family members and locals who are deeply critical of the decision and fear it will devastate their relatives. HSE Area Manager Joe Ruane is with us. Joe, you're very welcome to the programme.
Good morning, Will.
So when did you make this decision?
The decision was finally made yesterday and it was communicated last night to the residents, their families and staff.
But how much consideration was there in the build-up to this? Because the facility over the last 2 years has moved from 42 full beds down to 28. So it appears there was a longer-term plan to scale down the operation.
All right. Any decision, Will, to close or reduce any service isn't taken lightly. And in relation to the decision to close Abbeyleix Community Nursing Unit, there are a number of contributory factors that have led to this decision. The primary reason is the reducing budgetary allocation to provide services. All households within the country are aware that we must provide services and work within our budget, and so it is for the HSE. In addition, there's reducing staff numbers, and because of the inability to replace staff due to the reduced budget allocation and the public sector moratorium, services must reduce accordingly. And in relation to HICWA standards, I just want to clarify one issue, Will. It's in the future viability for the unit to meet HICWA standards, and I want to reassure residents and their families and the staff currently working in Abbeyleix Nursing Unit that our primary concern is to ensure a safe, effective, efficient service, and at this moment in time in Abbeyleix we're confident that that's happening. However, we cannot be confident of that going forward into the future. And on that basis, we carried out a review in relation to various services, and all services within the Midlands will be under consideration. And in this context, we have made the decision to close Abbeyleix Nursing Unit. OK,
so it's a preemptive move. You are satisfied that HICWA standards are being met at the moment?
Correct.
OK. Now, can we talk about the funding situation? Because you've alluded to what we are all aware of, and that's the very straitened financial conditions we find ourselves in. But how is this going to represent any savings?
Right. Before I address the funding issue, Will, and I will address it, I just want to acknowledge that the decision we accept is going to be distressful to residents and their families and to the staff. And nurse management locally and other colleagues are now consulting with residents and their families with a view to establishing their choice and preference for alternative accommodation options from their transfer from Abbeyleix.
Yes, and I'll happily get to that in a moment with you, yep. But I still want to pin down why this is necessary, and if financial considerations are a factor, how again do you propose to realise any savings from this?
No, to address that, Will, the cost of the Abbeyleix Nursing Unit service is 2.6 million in pay and 420,000 in non-pay. I was listening to your programme earlier on, Will, and one of the deputies highlighted that no staff will be losing their jobs as a result of that decision, and that is correct. Rather, the staff will be redeployed on the basis of discussions with them and their unions in accordance with the Crow Park Agreement, and redeployment will occur. Currently within the Midlands area, Will, up to the end of September, the HSE spent up to 4.75 million on agency staff. So some of the staff in Abbeyleix will be able to be used and redeployed to those areas where agency staff are being used. The other...
Have you a figure then on what saving that will represent?
Well, we're unable to confirm that until we discuss it with individual staff and their unions.
Because the counterside, as Deputy Sean Fleming alluded to earlier, is that the 28 residents will now have to be homed in private facilities, and he estimates that cost to be in the order of €30,000 per week or €1.5 million per year. So where's the economy?
All right. Excuse me. In relation to that issue that Deputy Fleming raised, I'd just like to clarify. No decision has been made as to where individual residents are going to go. Rather, consultation is now taking place with residents and their families to identify alternative locations. It may be within public nursing units, and it may be within private nursing units. So I think Deputy Fleming is assuming all the staff will transfer to a private nursing unit, and that may not be the case.
Right, but what public units in the area are accepting admissions?
Pardon?
What public units in the area are accepting admissions?
At this moment in time, no public unit is accepting admissions. The current...
well, in that case, is he not correct in assuming these people will be transferred to private facilities?
Any decision in relation to the admittance or the provision of care in any nursing unit throughout the Midlands is directly related to the clinical decision of the local clinician there.
Okay, but you just said,
very simply,
Mr. Ruane, with respect, you have just said that no public facility is accepting admissions at the moment. So therefore, the point is, these people will be, unless that policy changes, and are you going to indicate a change of that policy today?
Well, what I was going to try and say, and I appreciate maybe if I could just clarify it with the listeners, staff from Abbeyleix Nursing Unit, in discussion with them and the unions, will be redeployed to other locations. One area where they will be potentially redeployed is to backfill the use of agency staff. Another potential is where we have the physical space in some public nursing units, but we do not have the staffing to provide and open up additional beds. So if the residents or some residents in Abbeyleix were to transfer to another unit and staff were to go with them, we would be able to accommodate them. And in relation to the specific question that you asked me, Will, in relation to finances, the reality is the cost per bed per week at this moment in time in Abbeyleix is €1,800. And I think it was recorded earlier on that the cost in a private nursing home is €1,000.
So you argue it's more efficient to move these people to a private facility, but I still, with respect, think the numbers are a little bit vague, because you do not know at this stage how many staff can be redeployed to other nursing units, and therefore how many patients will move to public facilities. You therefore don't know how much money you are going to save by this, but potentially you're looking at an extra cost of €1.5 million if all of the patients move to private facilities. But even if some still go to public units, it's not going to represent a massive saving, is it?
All the staff will, in accordance with the terms of the Croke Park agreement and in discussions with them and the unions, will be redeployed to other locations within the Midlands. That's an important point to make. By them transferring to other locations, that will create the ability in some scenarios to accommodate residents from Abbeyleix who may wish to go to a public nursing unit. However, there are some residents and their families who may choose and prefer to go to a private nursing unit, and the cost there will be dependent on the private provider, but it will be significantly less than it currently occurs within Abbeyleix.
Okay, but what you're effectively saying, Mr. Ruane, is that you have taken this decision to close the facility on the basis of making savings, but you don't know what savings, if any, that will amount to.
You're asking me for a specific figure, and what I'm advising you, Will, is that I'm unable to give a specific figure until we discuss with residents and their families as to the options that they would wish, and secondly, when we discuss with staff and their unions as to what they would wish.
Okay, would it not have made more sense to have a period of consultation where you would then know what your financial position would be before making the decision?
The decision has been made. What we are now doing is consulting with residents and their families and with staff as to where they will now move to.
Okay, but you could end up in a position where you will realise no savings at all.
I don't accept that.
But you don't know because you haven't consulted yet.
I don't. Under the Crow Park Agreement, Will, and in discussions with staff and their unions, staff will be redeploying to other locations. I simply don't accept your summary that there will be no savings. That simply isn't acceptable.
But you can't prove otherwise. You don't have the numbers. You have to establish what the level of interest in moving will be, and then and only then will you realise if any savings will be made. Is that not a fair summary?
In terms of the specific number, that would be a fair summary. But our primary objective, is to ensure a safe, effective service for residents. We cannot continue to provide a safe, effective service in the future, given likely staff and further staff reductions.
How severely would those staff reductions, hypothetically, if the facility were to remain open, how many staff would you lose as a result of the new allocation?
In terms of 2011, since January 2011, we have lost, within the community service within the Midlands, 150 staff, and they haven't been replaced.
And in Abbeyleix?
In terms of, I'll address Abbeyleix in a moment, please. In relation to another factor I need to flag up, Will.
No, can we not finish the point about the staff levels in Abbeyleix first? Before you divert.
In terms of staffing levels within Abbeyleix, there has been 3 to 4 staff who have left in recent times, and there's potentially in all our nursing units up to a half a dozen staff who may leave before February 2012. February 2012 is an important date, Will, because a number of staff who may choose to retire in and during 2012 may decide to do it before February 2012.
Right, so potentially you could be down, including the staff who have already left, 5 or 6 members of the staff in Abbeyleix. What's the total complement working there?
The total complement, Will, and I suppose firstly there's 20 nurses, 22 multitask attendants, and 3 kitchen and catering associated staff. And I would like to acknowledge, Will, and this is very important, the commitment that has been shown by staff and the care that they have provided. And I know from earlier callers that was acknowledged on your show.
Indeed, and was acknowledged in the HICWA reports as well. So 45 odd members of staff, and 2 years ago they were catering for 42 residents, and now they're looking after 28. So on the basis that the ratio of residents to staff, if anything, has improved, how does your argument about losing a handful of staff make any difference?
Right. The current number of patients, both long stay and respite, within Abbeyleix at the moment, Will, is 28 long stay patients and 4 respite patients, so it's 32. We have 20 nurses, so the ratio is 20 nurses to 32 patients.
And what was the ratio 2 years ago?
I don't have that figure. The decision, and I just want to be very clear on this, Will, the decision concerning the number of patients that we can care for in any unit is a clinical decision and rests with the nurse manager.
But what I'm asking you, and you don't have the figure for 2 years ago, but has the ratio disimproved, the number of staff versus the number of patients, over the last 2 years, or has it improved because you haven't accepted new admissions and the number now stands at 28 or 32, depending on who you include?
In terms of the figure 2 years ago, I'm unable to give you that at this moment and time, Will. What I'm stating very clearly, today, based on the requirements of the residents, and that's the most important thing here, the requirement of the residents, that we have adequate staffing today. So in terms of whether the ratio was higher or lower compared to 2 years ago or now, what I'm stating very clearly is today we have adequate staffing for the number of residents that are there. However, going forward, we can't confirm that.
I'm working out the ratio approximately, and if you had a staff complement in the high 40s 2 years ago, and they were looking after 42 patients, you have a staff complement in the low to mid 40s now, and they're looking after 32 patients. It would seem that the ratio has improved. So you should, in theory, be doing a better job now than you were 2 years ago. It seems like an unusual time to make this decision.
Well, numbers in a clinical setting, to present them like that, at times may not be helpful, because behind every number is a resident. And every resident has a clinical requirement and a need that we within the health service must take care of. And the decision in relation to the number of residents that we're able to cater for in a safe, effective manner in all our units is a clinical decision. So it can't be done by an accountant, it's a clinical decision.
But behind every budget as well, as you say, is a patient. And
yes.
Here's what some patients said to the HICWA inspectors as recently as February of this year, saying that in one case, they feel very well cared for. The staff are great. Another resident complimented management and staff on the wide range of facilities available. One resident said, "As I am unable to live at home and depend on the people to do everything for me, I now see this as my home and I am very happy here." Are you aware of the impact this decision is going to have on them?
Absolutely. And in terms of breaking this decision and communicating this decision to the residents and the families and to the staff, the HSE have done all in its power to minimise the distress that the decision we accept will cause to residents and their families. Nurse management and local colleagues have met and are continuing to meet with residents and their families to discuss the reasons for the decision, but more importantly, and looking to the future, identifying and discussing with them their alternative accommodation options and preferences as to where they would like to go.
But again, the question is whether this distress is really necessary. You put up 3 planks: the staff level, the cost savings, and the adherence to HICWA standards. Cost savings, you don't know how much you're going to save. Staff levels, the ratio appears to have improved over the last 2 years. And the HICWA organisation has no issue with Abbeyleix at the moment. Are you for turning on this? Are you willing to consult, or is this a fait accompli?
The decision has been taken, and a decision like this, well, isn't taken lightly, and it's not taken in isolation in the Midlands. Rather, such a decision is critiqued and reviewed by colleagues within the HSE and the department nationally. We don't make such decisions to close the community nursing unit easily, and all such decisions are based on the primary concern, and that's the safety and welfare of residents going forward. I'd just like also to say...
Well, there is no evidence, as it now stands, that safety and welfare is in any way jeopardised.
As I speak to you today...
Can you address that point?
Yeah.
How, at the moment, is their safety and welfare in any way jeopardised?
I've agreed with you previously, Will. At this moment in time, I can absolutely confirm the safety as to residents within Abbeyleix. What I'm stating is, going forward, given the budgetary allocation, given the continued reducing staff numbers and our inability to replace staff, and the future requirements of HICWA, we will be unable to continue to provide a safe service. Specifically
because there won't be enough staff?
It's a combination of the factors I've said. Reducing budget, reducing staff numbers.
Well, they're interlinked.
Correct.
So it's specifically down to not having enough staff to look after these people?
At this moment in time, we have enough staff, adequate staff, and the requirements of the individual and collective patients in Abbeyleix are being provided. We cannot, and that is the reason the decision to close Abbeyleix Nursing Unit has been made, guarantee that in the future.
Okay, you've been listening to the programme, as I've gathered, and you are aware that already there is a huge degree of local opposition to this and quite an amount of anger. And there may be public protest, there will be public meetings, there may be marches. And is there any, and I know I asked you this already, but you didn't really address the point, is there any prospect of this decision being revisited and reconsidered?
The HSE, as I stated already, Will, doesn't take such decisions lightly. And once the decision has been made, we're now consulting with residents and staff in terms of where they now choose to move to.
Okay, just so we're clear, if I can rephrase the question again, are you open to changing? Is it a yes or a no?
The decision has been made in the interest of safety and welfare of residents, and no.
So what is the next step then? How will you consult with patients, with relatives, with their families on where they go next?
All right. I'd just like to add one thing before I address that specific question. Well, it is the Community Nursing Unit and the inpatient component of that is closing. There will still be services remaining open in Abbeyleix. There's a day service there where 90 service users of it avail every week. That will continue. There's primary care and associated services. That will continue. But addressing...
just as a matter of interest, does that not undermine your argument about cost savings a little bit? Because presumably you're going to retain a certain number of staff. How many, you might be so kind as to let us know, to provide those services?
Yeah, the figures I gave you were directly related to the inpatient unit and the community nursing unit. The costs associated with day services and primary care services are not included in the figures I gave you. In relation to what's happening now, nurse management and other colleagues are now discussing with residents since yesterday evening and today and over the period of time to discuss what options and preferences they have where they would like to go. We haven't put a timeline on that because different circumstances in relation to what residents may want and will follow. So that's what's happening at the moment. Each resident will be provided with a liaison person and their families, and if there's any questions or queries or concerns, that will be the person to contact ongoing. And as I said, the news has been broken last night directly to residents and their families. Regrettably, some family members and staff heard of the news before the HSE got communicated with them directly, and that was very unfortunate, and we would like to apologise for that.
When will the final phase of the closure be completed?
We haven't put a timeline on it, and it's very much dependent on the individual decision of residents and their families.
Okay, Joe Ruane, one last question, because a lot of people in the Portlaoise area are concerned about Shane Hospital as well, because there would seem to be parallels in that the number of patients admitted there has stopped altogether over the last number of years. Therefore, the number in residents has been reduced substantially. Are you going to make a similar announcement in relation to Shane at any point in the future?
No decision has been made concerning the closure of Shane Community Nursing Unit.
Is it being considered?
The decision made today has been the closure of Abbeyleix Nursing Unit. All services that we currently provide within the HSE are continually and consistently under review, given the reducing budget allocation we have, reducing staff numbers, and our paramount concern is to ensure that the 3,500 staff who are working within the community service in the Midlands and the 290 million plus budget is provided for the benefit of the Midlands, and that a safe and effective and efficient service is provided.
Okay, and in view of that, are you actively considering the closure of any other facilities?
The decision today is just that.
Not what I asked you. Are you actively considering the closure of any other facilities?
We're constantly reviewing the service in all locations within the HSE.
Joe Ruane, Area Manager with the HSE. Thanks for taking our call today.
You're welcome.